Hi, Dr. Adam from Skinphinity here, just continuing some videos during lockdown, just talking about the non-surgical nose job, non-surgical rhinoplasty as it's also called. It's just really useful for people that have a large dorsal hump from the side or from the front if they've got a deviation in the cartilage. So the nose isn't looking straight at all, it's like very windy. Um, and also it can help with the tip. So if you've got a very droopy tip, particularly as a female, this is a very unfeminine trait that some people like to try and improve. So there are various things you can do, and there is one. There's a trend at the moment called the Tinkerbell tip lift, which is to give the tip of the nose a very sort of almost like Disney-like tip lift. So there are various ways to treat the nose. Now we use dermal filler, so it's helping to support the structures underlying where they're lacking, if there's a lack of fat, tissue, cartilage, bone. So it does depend on where the problem is and your individual anatomy. But I have to say the results from this can be amazing, and actually the reactions you get from people after the rhinoplasties are probably more drastic than any other treatment. I think it's something that really affects people's confidence almost more than anything, the shape of the nose. So we've seen all sorts in clinics, tears and hugs, and it sounds a bit as an exaggeration, but people genuinely, there's a huge improvement to people's quality of life and confidence after this treatment. So that's really nice to see. There are some risks, so it's important that you go to someone qualified and experienced, and please do your research before. This is not a procedure that should be done in someone's kitchen or in the living room. It should be done in a more clinical environment. And actually you need to explore whether your practitioner knows the side effects well enough and the risks, and can they deal with them effectively. It's all very well knowing about them, but what is their plan of action? I think I would push and explore that. That's really important. This is a procedure not without risks, including blocking arteries, so that's really important. So yeah, just talking about the tip lifts as well. It can be nice to lift the tip of the nose, and there's various ways to do this, but some people advocate not to inject the tip of the nose because of the risks to the arteries there, causing skin necrosis. I personally take it on a case by case basis, and it also is important to me how much my patients understand the risks and the benefits and that sort of thing. So but don't take the tip lifts lightly. The tip is a dangerous area to inject, so again, make sure that you're discussing this fully with your practitioner. It shouldn't be a fad or a trend that is just done willy-nilly. But yeah, if you've got any questions about the non-surgical rhinoplasties, please let me know. You can DM me or follow me on Instagram and Facebook at Skinphinity. I hope that's helpful, and I'll do another video soon.